Top 5 causes of protein in urine and kidney stones, according to top nephrologist. One of the earliest signs that the kidneys are not functioning the way they should is the leaking of protein into the urine, medically referred to as proteinuria. In a healthy body, the kidneys filter out the waste and excess fluids, while the essential proteins remain inside the bloodstream. But when that filtering system is damaged, the escaping proteins begin to exit through the urine. Many of the conditions that cause this leakage can also increase the risk of kidney stones. This may be one of the reasons nephrologists see these two issues so often in conjunction. Understanding the reasons behind this may help people recognize symptoms early and protect their kidney health. Top nephrologist Drive, Nikita Pawar, shared the reasons behind protein leakage into the urine. 2. Autoimmune antibodies attacking the kidneys. Autoimmune disease is one of the main causes of protein leakage. In most instances, such as lupus nephritis, IgA nephropathy, and other forms of glomerulonephritis, one's immune system mistakenly attacks the kidney's filtering units. These filters, known as glomeruli, become inflamed and cannot prevent essential proteins from passing into the urine. Prolonged immune-related inflammation creates an imbalance in the minerals present within the urine, thereby creating conditions more suitable for the formation of kidney stones. Consequently, there is disturbed management of uric acid and calcium through the kidneys, potentially leading to crystallization and subsequent stone formation. Most patients with autoimmune kidney disease experience both proteinuria and the development of stones. For this reason, early diagnosis and medical treatment are valuable to avoid renal impairment that may lead to permanent damage. 3. Uncontrolled diabetes. The most common cause of proteinuria that occurs throughout the world is uncontrolled diabetes. High blood sugar destroys tiny blood vessels inside the kidneys. The medical term for this is diabetic nephropathy. After many years, filtering units thicken and stiffen, making them less able to filter waste. When these filtering units are eventually weakened, they begin to let protein escape into the urine. Diabetes also impacts how the body processes a number of important minerals. Many individuals with high blood sugar excrete increased amounts of calcium, uric acid, and oxalates into their urine. At the same time, they generally have lower levels of citrate, a naturally occurring substance that inhibits the formation of stones. This can predispose them to renal colic. Poorly controlled diabetic patients may excrete even more acidic urine, thereby increasing the risk of uric acid stones. Blood sugar management is one of the best ways to protect both kidney function and overall urinary health. 4. Uncontrolled high blood pressure. As the kidneys weaken, the mineral balance in the urine shifts. Calcium levels often increase, heightening the risk of developing calcium-based stones. If kidney stones do form, they can further irritate the urinary system and elevate blood pressure, creating a self-reinforcing cycle where high blood pressure and kidney stones feed into each other. Controlling blood pressure is one of the major steps to prevent both proteinuria and the formation of stones. Chronic high blood pressure places constant strain on the delicate tissues inside the kidneys, gradually wearing them down. Over time, this ongoing pressure leads to scarring and weakens the filtration barrier responsible for keeping essential proteins in the bloodstream. Once this barrier is damaged, protein begins leaking into the urine. Uncontrolled high blood pressure also restricts blood flow to the kidneys, reducing their oxygen supply and causing further tissue injury, which can eventually impair overall kidney function. 5. Congenital or inherited kidney diseases. Some individuals are born with structural abnormalities or inherited disorders of the kidneys. Examples include polycystic kidney disease, Alport syndrome, and congenital obstructions. Since the kidneys may be malformed or genetically predisposed to weaken, leakage of proteins can appear early in life. These conditions can also have an impact on the pattern of urine flow or on mineral processing. Poor drainage, repeated infections, or unusual tissue growths can provide ideal conditions for kidney stones to form. Individuals with congenital kidney disorders usually need to be monitored throughout their lives. Early diagnosis of proteinuria and early passage of stones can often avert more serious complications later. Chronic renal infections, recurrent urinary tract infections or chronic inflammation in the kidneys can progressively weaken tissues over time. With progression, this becomes a less effective filtration system that starts to allow protein to escape into the urine. Chronic infections are also known to encourage stone formation as they change the pH of urine, increase bacterial buildup, and create debris that acts as a seed for stone growth. One kind of stone, called a struvite stone, can form in response to an infection. These stones can grow quite large and may fill the renal pelvis, taking the shape of it. Therefore, quick treatment and prevention of recurrence of infection is important in kidney function protection. Timely evaluation and consistent follow-up care are crucial, as early intervention can slow disease progression and significantly preserve long-term kidney function. Maintaining hydration, following medical guidance,